Welcome to Natural Solutions, your guide to evidence-based home remedies for common health concerns. I'm your host, Lindiwe, and today we're talking about something that affects all of us, dental plaque. Did you know that the battle against plaque begins just hours after you brush your teeth? That's right. This sticky biofilm starts forming almost immediately, and if not properly addressed, leads to tartar buildup, gum disease, and cavities. While regular brushing, flossing, and dental visits remain essential, many traditional and natural remedies can give you an extra edge in this ongoing battle. Today, we'll explore scientifically backed home remedies that can help keep your smile healthy and bright. Before we dive in, a quick disclaimer. These remedies are meant to supplement, not replace, your regular oral hygiene routine and professional dental care. If you have specific dental concerns, please consult your dentist for personalized advice. Understanding dental plaque. Let's start by understanding exactly what plaque is and why it's so persistent. Dental plaque is a sticky biofilm primarily composed of bacteria. In fact, over 700 species of bacteria have been detected in the human mouth. This film constantly forms on our teeth, combining bacteria with food debris, mucus, and other substances. What's concerning is how quickly it forms. Studies show plaque can begin reforming within 4 to 12 hours after thorough cleaning, and without regular removal, plaque can harden into tartar in as little as 24 to 72 hours. Once it becomes tartar, you can't remove it yourself. You'll need a professional dental cleaning. This is why the fight against plaque is ongoing. Regular brushing and flossing help, but they have limitations. Brushes can't always reach every surface, especially between teeth and along the gum line, which is precisely where plaque likes to accumulate. According to the CDC, nearly 50% of adults aged 30 or older show signs of gum disease, a direct consequence of plaque buildup. This statistic highlights why we need to be proactive about plaque removal. Evidence-based home remedies. Now let's explore home remedies with scientific evidence supporting their effectiveness in fighting plaque. Oil pulling. Our first evidence-based remedy is an ancient practice called oil pulling. This technique, which originated in Ayurvedic medicine thousands of years ago, involves swishing oil, typically coconut, sesame, or olive oil, in your mouth for about 15-20 minutes. Here's how it works. The oil binds to bacteria in your mouth, effectively pulling them away from your teeth and gums. When you spit out the oil, you're also spitting out these harmful bacteria. Several small clinical trials have shown that regular oil pulling can significantly reduce plaque buildup and even help with gingivitis. Studies suggest oil pulling can reduce plaque index by 30% when practiced regularly. Coconut oil seems particularly effective, likely due to its high lauric acid content, which has antimicrobial properties. To try oil pulling, start with just a tablespoon of oil. Swish it around your mouth, making sure to push and pull it between your teeth. This can be challenging at first. If 15 minutes seems too long, start with 5 minutes and work your way up. Important tip: always spit the oil into the trash, not your sink, as it can solidify and cause plumbing issues. Baking soda brushing. Next up is a remedy you probably already have in your kitchen cabinet: baking soda. Baking soda, or sodium bicarbonate, has been used for oral care for generations, and for good reason. Its mildly abrasive texture helps scrub away plaque, while its alkaline nature neutralizes acids in the mouth that contribute to tooth decay. Multiple studies confirm its effectiveness in plaque reduction. In fact, many commercial toothpastes include baking soda as an active ingredient. To use baking soda for plaque removal, simply mix a small amount with water to create a paste. Apply this to your toothbrush and brush normally for 2 minutes. Some people add a drop of peppermint essential oil for flavor, but plain baking soda works just fine. Don't worry about it being too abrasive. Studies show it's actually less abrasive than many commercial toothpastes when used properly. Saltwater rinse. A simple saltwater rinse is another effective remedy against plaque. Mix half a teaspoon of salt in a glass of warm water and use it as a mouthwash. The salt creates an alkaline environment that inhibits bacterial growth and has anti-inflammatory properties. Clinical evidence supports its effectiveness, particularly for reducing inflammation associated with gingivitis and early-stage gum disease. It's especially useful after meals when brushing isn't convenient. This remedy is particularly beneficial during the early stages of gum inflammation as it helps reduce swelling and fight infection. Hydrogen peroxide diluted rinse. Hydrogen peroxide is a powerful ally in the fight against plaque. As an oxidizing agent, hydrogen peroxide kills bacteria through oxidative stress. Multiple studies confirm its antimicrobial properties and effectiveness in reducing plaque. To use it safely at home, always dilute 3% hydrogen peroxide with equal parts water. Swish this solution in your mouth for about 30 seconds, then rinse thoroughly with plain water. Important caution: never swallow hydrogen peroxide, always dilute it properly, and don't use it daily for extended periods as it can potentially irritate gum tissue with overuse. Green tea. Here's a remedy you can simply drink: green tea. Green tea contains compounds called catechins that inhibit bacterial growth and reduce inflammation. Several studies show positive effects of green tea on oral health, including plaque reduction and cavity prevention. You can either drink green tea regularly or use cooled green tea as a mouth rinse. For maximum benefit, drink it without sugar, as sugar can contribute to plaque formation and tooth decay. Natural brushing with neem or miswak. Long before commercial toothbrushes existed, people cleaned their teeth with twigs from specific trees, and modern science now confirms their effectiveness. Neem sticks from the Indian lilac tree and miswak sticks from the Salvadora persica tree have natural antimicrobial compounds. Multiple studies confirm they provide comparable or even better plaque control than regular brushing. These natural brushes release protective compounds as you chew on the end to create bristles. Then you use these bristles to clean your teeth. They're completely natural, biodegradable, and effective at removing plaque. Emerging remedies worth trying. Now let's look at some promising remedies with emerging evidence. Aloe vera. Aloe vera gel, known for its skin benefits, also shows promise for oral health. It contains compounds with antimicrobial properties that may help reduce plaque. Limited but positive clinical trials suggest benefits when used for brushing or as a mouthwash. You can apply a small amount of pure aloe vera gel to your toothbrush or dilute it with water as a mouth rinse. Apple cider vinegar. Apple cider vinegar has gained popularity for various health applications, including oral care. The acetic acid it contains may help break down plaque and kill bacteria. However, evidence for its effectiveness is limited and mostly anecdotal. If you want to try it, be extremely cautious. Always dilute it heavily, 1 part vinegar to 3 parts water, and rinse your mouth with plain water afterward. Important caution: regular use of undiluted apple cider vinegar can erode tooth enamel, so use this remedy sparingly and always in diluted form. I'm joined now by Dr. Wendy, a preventive dentistry specialist with over 20 years of experience.
Thanks for having me. While I'm encouraged by the growing interest in natural oral care, I want to emphasize that these remedies work best alongside regular dental care, not as replacements.
Excellent point. Are there any cautions our listeners should be aware of?
Absolutely. First, be careful with acidic substances like apple cider vinegar. Always dilute them properly, use them sparingly, and rinse with plain water afterward to protect your enamel. Second, if you have existing dental work like crowns or veneers, check with your dentist before trying oil pulling or other remedies that might affect adhesives or materials. Finally, persistence is key. Natural remedies typically work gradually, so consistency in your routine matters more than intensity.
That's helpful perspective. What would you consider the most evidence-backed natural approach?
Besides the absolute fundamentals of proper brushing and flossing, I'd say using a baking soda paste has the strongest evidence behind it. It's gentle yet effective, and numerous studies confirm its plaque-fighting properties. Many commercial toothpastes include it for good reason.
And for our listeners who want to completely avoid commercial products,
Neem and miswak sticks have centuries of use and modern research backing their effectiveness. They're completely natural and contain compounds that directly target the bacteria in plaque.
integrating remedies into your routine. Let's talk about how to effectively incorporate these remedies into your daily routine. The key is consistency rather than trying everything at once. Start by adding one remedy to your existing oral care routine. For example, try oil pulling in the morning, followed by your regular brushing and flossing, or use a saltwater rinse after lunch when you can't brush. For frequency recommendations, most of these remedies can be used daily, except for hydrogen peroxide. Limit to 2 to 3 times weekly, and apple cider vinegar, once or twice a week at most. As for signs of improvement to look for, reduced gum bleeding, less sensitivity, fresher breath, and that smooth feeling on your teeth when you run your tongue across them. Remember that results won't be instant. Give any new remedy at least 2 weeks of consistent use before evaluating its effectiveness. Beyond remedies, holistic oral health. While we focused on direct plaque-fighting remedies, several lifestyle factors significantly impact your oral health. Limit sugary foods and beverages as sugar feeds the bacteria that form plaque. Stay hydrated to maintain adequate saliva production. Saliva is your body's natural plaque fighter, washing away food particles and neutralizing acids. Avoid smoking and excessive alcohol consumption, which increase plaque formation and gum disease risk. Replace toothbrushes every 3 to 4 months or sooner if bristles are frayed. Use proper brushing technique, gentle circular motions for at least 2 minutes twice daily. Clean your tongue daily to remove bacteria that contribute to plaque and bad breath. Conclusion. As we wrap up today's episode, let's summarize the key takeaways. First, dental plaque is a constant concern that requires ongoing care, not just occasional treatments. Second, several natural remedies have scientific evidence supporting their effectiveness, from oil pulling to baking soda brushing, saltwater rinses to green tea. Third, these remedies work best when integrated into a comprehensive oral care routine that includes proper brushing, flossing, and regular dental checkups. Remember, your oral health affects your overall well-being. Taking the time to care for your teeth and gums pays dividends not just in your smile, but in your general health as well. If you've tried any of these remedies or have questions about today's episode, we'd love to hear from you. Visit our website at happyguthealthybrain.blogspot.com or leave us a comment wherever you get your podcasts. Until next time, this is Lindiwe reminding you that small, natural solutions can make a big difference in your health journey. Take care of those teeth, and I'll see you next week when we explore natural remedies for seasonal allergies.